A quick review: the pharmacology of the anti-diabetic drugs. Decreased insulin secretion is a very important factor leading to hyperglycemia. The secretion of insulin, it is from the beta cells in the pancreas. Now let me enlarge one of these beta cells. In the beta cells here, we have a potassium channels. These potassium, they are normally open and letting the potassium to get from the higher concentration inside the cell to the lower concentration. And we have also calcium channels. These calcium channels normally will be closed. And the insulin, it will be stored inside a vesicles inside the beta cells. Now, also we have in the beta cells, we have a glucose transporter type 2. Now, that's whenever we have an increase in the blood glucose in the blood. So now the beta cells will be sensing that, and the glucose transporter type 2 will be allowing the glucose to go from the higher concentration in the blood to lower concentration inside the beta cells. And there it will be metabolized under different types of enzymes, will be leading finally to producing more adenosine triphosphate, the ATP. The ATP now will be affecting the potassium ATP sensitive channels and will be leading to close these channels. Now, closing the potassium channels will be leading to accumulation of the potassium inside the cells. So that will be because it is a positively charged, so that will be leading to a depolarization. The depolarization will be leading to an activation or opening of the calcium channels. So the calcium now will be enter and will be enabling now to the fusion of the vesicles which containing insulin with the cell membrane and exocytosis of the insulin. So we have an insulin release. So now we have drugs that stimulating the insulin release by binding to the sulfonylurea receptors. These potassium channels, we call it a sulfonylurea receptors. So these sulfonylurea drugs will be blocking the potassium channels and will be producing a depolarization of the cells, and that will be opening the calcium channels and will be enabling finally the release of insulin from the beta cells. So the sulfonylurea drugs, by blocking the potassium channels and opening the calcium channels, letting the insulin to release. These medication, we have two generations. We have the first generation sulfonylurea. We have different types of drugs, but now the ones that are still usable in some patients, specifically the elderly, because considered to be safe, tolbutamide, giving 500 milligrams before each meal. However, now the most ones that being used, it is the second generation. The second generation sulfonylurea, you can see it that almost all of them will be given as a single dose, and all the name of the second generation sulfonylurea was starting with G, and all the sulfonylurea names will be ending with IDE. For example, second generation glyburide. So that's now the major toxicity for these agents, since they are releasing the insulin, will be leading to hypoglycemia if it's being given by inappropriate dose or if it's given without taking the food. A second group of medication that will be working by stimulating the release of insulin through binding to sulfonylurea receptors is the meglitinide analogs. Now these medication will be blocking the potassium channels, and then the calcium channels will be open, and the release of insulin will be taking place. So this group of medication, meglitinide, they are almost, we said, that producing the same effect as sulfonylurea, and they have two binding sites exactly the same as sulfonylurea, but also they have another binding site. Now, these medication I am going to mention two of them. Ribaglinide, which is supposed to be given before each meal, and it has no sulfur in its structure, so it will not producing a hypersensitivity or allergic reaction. And we have netiglinide. Now this medication, you can see it, they are ending with a glinide, and they have less affinity for the receptors than sulfonylurea and dissociate faster from it. Now, as any medication that will be releasing insulin, the major side effects will be hypoglycemia, but still it is less than the one will be produced by sulfonylurea.